Women find the subject of prolapse or incontinence difficult to talk about, and I think one of the big advantages that I have is that I'm a female urologist, and I feel that I can sit and talk with my patients and really get a good understanding of their type of problems. Women have felt this issue to be a taboo for many years, and I think with all the different procedures out there, they don't need to feel like that. I think one of the most important things that I offer is mainly talking to the patient and letting them know that even if they are not a candidate for a robot surgery, there are other ways to repair their problems and other ways to address their issues. Not only as a surgeon do I discuss invasive and minimally invasive techniques, I also look at conservative approaches and ways and behavior and diet modification, and I incorporate that into my practice. Prolapse is caused by various factors. Women who have undergone childbirth, women who have had previous surgeries, women who have gone through the changes of life. These are all factors that may predispose a woman to prolapse. Essentially, what prolapse is a descent or a fall of either your bladder or your rectum or the vaginal area that falls into the opening of the vagina, thus causing problems. For instance, women may present with bladder problems where they feel that there's a lot of pressure, they can't void, they have urinary problems. Some women have bowel movements or defecatory problems. And some women present with a heaviness that bothers them during intercourse. When I see someone with prolapse, I do a thorough exam looking for what is causing their symptoms. In the past, surgery for prolapse has been approached by many ways. Some of those ways we still use today, and some we've modified and improved on. Not all women are candidates for surgery. Some women don't want to have surgery, so we use a pessary, which is a soft, pliable device, almost like a tampon, that is inserted in the vagina that helps women who have a prolapse type problem. Other women are candidates for surgery and want to have the problem fixed. Years ago, they used to do an abdominal approach where they used to, the woman was brought to the operating room, underwent an abdominal repair to repair her fallen vagina. This surgery worked well. However, you know, the woman was in the hospital for many days, and it's a very tough recovery. There have been other surgeries such as laparoscopic bladder repairs, and these have been modified. More recently in history, there have been vaginal mesh kits that have used a synthetic mesh to support the vagina. In picking a type of surgery, we have to look at the individual and make sure that type of surgery is going to suit them. One of the newer techniques that I perform is a robotic sacral colpopexy. Essentially, this is a minimally invasive procedure that is just like the abdominal sacral colpopexy, except we're not making a large incision. The robot is a device that allows the surgeon to have 360 degrees of dexterity to move those instruments 360 degrees around in a very small space. The surgeon is sitting at a console operating these instruments. So as you can see, I mean, to be able to work in a small, tight space as a woman's pelvis, the robot has really improved a lot of things. Typically for the robot, we make a camera port incision, and then we have 4 other small incisions. And when I say incisions, these are very small, smaller than 2-inch incisions that allows our ports to fit through. One of the advantages of the robotic surgery is it really cuts down on blood loss. We rarely have ever had to transfuse a patient for blood loss. We have minimal blood loss with the robot, so I think that's a huge advantage to my patients. Well, we've done women as young as in their 40s up to their 80s. You have to meet certain criteria to be a good robotic candidate, but if you are, this is a very good way to fix a severe prolapse. You may want to know what some of the criteria are to qualify for a robotic procedure. First of all, just because you have prolapse doesn't mean you have to have surgery, or you don't have to have the robotic procedure done. Some women have a mild degree of prolapse, and although this can be quite bothersome, I don't think a robot procedure is indicated. In these women, sometimes we do a vaginal approach and use a mesh procedure to re-support the vagina. However, in those women who are considered for the robot, usually these women have at least a grade 3 type prolapse. It's very bothersome to them. They're very symptomatic. They haven't had a lot of previous abdominal surgeries, because if a woman has had a lot of abdominal surgeries, as you can imagine, there may be a lot of scar tissue there, making it difficult to place our ports. And then overall health. It's very important for a woman to go see her primary care physician to make sure that she is a good candidate for surgery. But this obviously is for all types of surgeries. In general, the robotic sacral colpopexy can take anywhere from 2.5 hours to under 4 hours. A lot of it depends on previous surgeries that a woman has had. Also, a woman's tissues sometimes are thin compared to another woman, and it becomes more tedious, the dissection. Most women are in the hospital overnight and go home the very next day, usually without a Foley catheter. For the first 2 weeks, that's usually the roughest time. Women tend to feel a little bit more sluggish and tired. They're usually up walking, they can walk stairs, but that's a critical time because they're tend to be tired. Convalescence is usually 6 weeks, and by 6 weeks, most are completely recovered to resume work. After 2 weeks, I do let women drive if they're not on pain medicine or not hurting too much. One thing that I do in my practice is I use a pain pump that is placed at the end of the procedure. It takes no time to do and adds a whole lot of benefit. This provides pain relief so that the person does not have to use a lot of narcotic pain medicine, and it usually lasts for about 3 days, and the patient removes it at home in a very easy way. Typically, after a woman has any sort of pelvic surgery, I usually recommend 6 weeks of no sexual activity. After that time, I have people come back for an exam, and 90% of women can resume sexual activity at that time.